Since COVID-19 hit in 2020, the UK has seen over 4.8 million cases. Some of these patients have since been suffering with long COVID symptoms and have been unable to return to normal. We spoke to Professor Charlotte Bolton, Clinical Professor of Respiratory Medicine here at Nottingham University Hospitals Trust, about the importance of the newly funded Nottingham Health Recovery Research Centre.
So this has been open for several weeks now, and we've seen a good number of patients come through for the clinic and for the research, and they've been really staggered by the provision of space and opportunity for us to see them. There are 4 areas like this here, with a separate breathing test assessment area, a waiting room, and so a patient can come into an area. There are opportunities to actually do all of the clinical assessments and filling in all the questionnaires and examining the patient in the one area, and then the patient can leave and it all can be wiped down, as opposed to going from one area to another area to another area. It's been absolutely vital to do the research and to do the clinical assessment. We've needed the space, particularly as other clinics have restarted after the acute infection. The wave 2 has settled and we've been able to restart those services. This space also gives the reassurance to patients. It's all wipe downable, it's all cleanable, and it also allows the patient or the research volunteer to come to one area, to be based in that one area, and know that they're not mingling with lots of other patients in the corridors or going to lots of other departments. So we've been really immensely grateful for the hospital charity's support in funding a series of pieces of equipment, including some of the things around me, the scales, the blood pressure machine, the ECG, the couches, the chairs, other things off screen, the screens themselves actually, in enabling an area that was provided for by the university to become a clinical and a clinical research area for us to take up this new area of clinical need for these people with persisting symptoms after COVID-19 infection. Alongside the support from the hospital charity, a huge thank you to the patients and the volunteers that have taken part in the research. Many of them have got symptoms that they're struggling with day to day, and they've gone out of their way to then provide more time to complete more questionnaires and more assessments for the research, and that doesn't go unnoticed.